Good morning, afternoon, evening, respected guests. On this occasion, I would like to share knowledge about one of the common diseases experienced by the elderly, namely hypertension. Hypertension or high blood pressure is a medical condition that is very important to pay attention to, especially in the elderly. Let's examine more deeply about hypertension, its causes, symptoms, and how to overcome it. Hypertension is a condition when blood pressure in the arteries increases abnormally. Blood pressure is measured in two numbers: systolic pressure top number and diastolic bottom number. Blood pressure is considered high if the systolic reading reaches 140 millimeters of mercury or more, and the diastolic is 90 millimeters of mercury or more. It is important to remember that hypertension is often called the silent killer because it does not show clear symptoms, so many people do not realize they have this condition until complications arise. Causes of hypertension: there are various factors that can cause hypertension, including 1. Age. The older a person is, the greater the risk of developing hypertension. 2. Genetics. A family history of hypertension can increase the risk. 3. Lifestyle. A high salt diet, lack of physical activity, obesity, and alcohol consumption and smoking. 4. Stress. High levels of stress can contribute to increased blood pressure. Symptoms of hypertension: hypertension often has no symptoms, but there are some signs that may appear, such as 1. Headache. 2. Dizziness. 3. Shortness of breath. 4. Heart palpitations. However, it is important to emphasize that many individuals can experience hypertension without feeling any symptoms. Therefore, regular blood pressure checks are very important, especially for the elderly. Impact of hypertension: uncontrolled hypertension can cause various serious complications, such as 1. Heart disease, including heart failure and heart attack. 2. Stroke, increased risk of stroke due to rupture of blood vessels in the brain. 3. Kidney damage, hypertension can affect kidney function. How to overcome hypertension: overcoming hypertension is very important to maintain the health of the elderly. There are several steps that can be taken. 1. Healthy diet. Reduce salt intake, and increase fruit and vegetable intake. The dietary approaches to stop hypertension. Diet is one of the recommended diets. 2. Physical activity. Do regular exercise, such as walking, cycling, or light gymnastics for at least 30 minutes a day. Be sure to consult a doctor before starting a new exercise program. 3. Stress management. Practice relaxation techniques such as meditation, yoga, or deep breathing to reduce stress. Try to maintain a balance between activities and rest time. 4. Routine checkups. Have your blood pressure checked regularly, at least once a month, or as directed by your doctor. 5. Medication. If directed by your doctor, use the appropriate antihypertensive medication. Be sure to follow the instructions for use of the medication correctly. Conclusion: that is the information about hypertension, one of the common diseases faced by the elderly. Awareness of this disease and proper management are very important to prevent complications and improve quality of life. Let us all commit to living a healthy life and paying attention to our heart health. Thank you for your attention. Do you have any questions?